Hi, I'm Robert Nicholson, and I'm the president of the ED Treatment Information Center. Today, I'm going to be talking to you about the COVID-19 virus. Now, you may be wondering why we're talking about the coronavirus on the ED Treatment Information Center channel. First, the virus has nothing to do with ED, okay? But we're posting this for two reasons. A lot of people who follow us are older men, and older men are much more at risk due to this virus. We also have a lot of experience following medical research and presenting it in a clear, factual manner. There's a lot of misinformation being circulated, and we want to help clear things up. So let's get started. You're seeing all kinds of stuff on the internet and in the news. A lot of it is wrong, and some of it is dangerous. I know everyone is worried and wants information, but misinformation doesn't help anyone. Medical research takes time. Even with thousands of people working and lots of money, it still takes time. Weeks, months, even years. So don't expect significant results soon. And please don't listen to rumors or stuff you're seeing posted on Facebook. For solid, up-to-date information, please check everything you read on the Center for Disease Control website at cdc.gov. What we do know at this point is the really important stuff, the big picture, and that's what I'm going to be talking about today. In recent years, the world has dodged a couple of bullets. The SARS and MERS virus outbreaks were quickly contained. But we know what happens when a pandemic isn't contained. In 1918, a flu outbreak infected a third of the people in the world. Over 50 million people died. In the United States, there were 675,000 deaths. That's 6.5% of the US population at the time. Now today, we worry a lot less about the flu. There are a lot of people with partial immunity because they've had the flu before. And in the US, about 40% of adults get a flu vaccination every year. So that slows the spread of the virus. But the COVID-19 virus is new. Nobody has immunity. There's no vaccination. And as we will see, it's a lot worse than the flu. So yes, I'm not going to sugarcoat it. Things are going to get really, really bad. Since the worst epidemic in US history was due to the flu, that's a useful comparison. Let's look at how easy it is for the virus to spread. Scientists call this the R0 value. For the flu, the R0 value is 1.3. That means, on average, every person with the flu infects 1.3 other people. For the COVID virus, that number is somewhere between 2 and 3. In other words, the virus spreads much more easily. For the flu, the mortality rate is 0.1%. That means for every 1,000 people who get the flu, 1 will die. We don't know the mortality rate for COVID yet, but we're seeing data showing rates of 0.7% to 3.5%. Whatever the final number, it's much more deadly than the flu. A lot more people are going to die. Now we know that it's much more severe for older people or people with pre-existing respiratory conditions. We don't know why, but the overall mortality rate is very, very high. And as I mentioned already, the spread of the flu virus is slowed because there are a lot of people with immunity. That means there are a lot of people who can't get infected and can't pass it on. For COVID, there is no immunity. Another thing we know about the flu is that it's seasonal. We've all heard about the flu season. The flu virus doesn't do well in warm, dry conditions. So during the summer months, infections rates goes down. We don't know yet if COVID is seasonal, but we can hope that it is, but we really don't know yet. Finally, both the flu and COVID can be spread asymptomatically. That means people can carry the virus and infect other people before they even know they're sick. And that's why testing is so important. We need to identify people who are infected so they can be isolated and treated and not spread the virus to other people. We need to get real about this. Despite what you hear, this is not just a cold. It's a deadly epidemic. Let's take a look at what works and what doesn't, and what our government needs to be doing. As I said, because of asymptomatic transmission, many people are spreading the virus without even knowing they're infected. Countries that have gotten the COVID virus under control, China and South Korea, have done testing on a massive scale, and the US is way, way behind. South Korea has already tested about 6% of their population. The US tested 0.01%. There are a lot of people in the US who are saying, we don't have coronavirus in my state. They're wrong. The virus has spread. We just don't know it because the US has not been testing people. And by the time symptoms appear and cases are reported, it's too late. It has already spread through your community. Another thing that we know works is social isolation. That means people need to stay at home. Public gatherings need to be shut down. That includes restaurants, bars, churches, sporting events. Some states have already done this, but it's not yet nationwide, and it needs to be, because that's the only thing that can slow or stop the spread of this virus. Remember, the virus is already circulating in your community, wherever you live. The time to stop it is now. Above all, the federal government needs to stop sugarcoating this. In 1918, the United States was still at war. The last thing the government wanted was to create a panic. And so they suppressed news about the epidemic and they downplayed the severity. That's one reason over 500,000 Americans died. When our government downplays the severity of this epidemic, they're putting every American at risk. We also need to increase the number of doctors, nurses, and medical staff that we will need to fight this virus. Hospitals in other countries are already overwhelmed. We need to pass emergency legislation to allow retired medical personnel and medical students to aid in fighting the epidemic. And here's what you need to do. First, stop going out in public if at all possible, even if there aren't restrictions in your local area yet. You may already have the virus and you could spread it to others. If you don't have the virus, you can easily get infected from someone else who doesn't know they're infected. If you must go out in public, try to keep a distance of 6 feet between yourself and other people. That's about how far the virus can spread from coughing, sneezing, or even normal breathing. Now, you may be a young, healthy person. Even if you're infected, you may come through this with little more than a few days of feeling bad. But you may be spreading the infection to friends, neighbors, and relatives who can die as a result. If you have to go out in public, avoid touching things. The virus can stay alive on surfaces anywhere from a few hours to 3 days. Wear gloves. You don't need those fancy plastic gloves that doctors wear. Use garden gloves. Just avoid touching things. And wash your hands. When you wash, at least 20 seconds with hot, soapy water. And don't touch your face. Now, I've been amazed, now that I'm paying attention, at how often I touch my face. If you have the virus on your hands, touching your face will allow it to enter your body. So you need to stop doing that. Here's the bottom line. Don't let anyone tell you that this is just a hoax or overhyped. The best doctors and scientists in the world are telling us that this could be a global catastrophe. In times of war, every American pitched in to help with the war effort. We mobilized every possible research. Yet no war in American history killed as many people as the flu pandemic in 1918. We are at war, and it's a war we need to win. I hope you take this message seriously. The goal of the ED Treatment Information Center is to provide accurate information based on the best science available. And the best science is telling us that the COVID-19 virus could be the most deadly epidemic in American history unless we all work together to fight it. Till next time, bye.